I'm Beth Ward, a physical therapist at Cutting Edge Pediatric Therapy, and I want to talk a little bit today about two conditions that are commonly seen in newborns. One is called torticollis, and that occurs when a baby tends to tilt their head to one side, and they may have limited rotation to follow a visual stimulus or an auditory stimulus to the other side. So that decreases the range of motion that they have in turning their head from side to side. The other condition is plagiocephaly, and that is a long name for the flat head syndrome. And that occurs because babies spend a lot of time on their backs since the inception of the Back to Sleep program by the American Academy of Pediatricians in the early 90s. So babies are sleeping on their backs, and they spend a lot of time in equipment such as swings and car seats and baby bouncers. So there's been a huge increase in the incidence of these two conditions. So what I want to talk about today is what we can do so that those conditions don't persist in your baby, because the development of head control and trunk control is what is contributing to having motor delays in children that demonstrate one or both of these conditions. So one of the big things that you can do is to limit the time that babies spend on their backs. And that means that you should be doing tummy time, even with a brand new baby. So tummy time can be done with you holding the baby on your chest, and they love to look up at mom or dad. It can be done on a surface like the floor, but when you're working with a very young child on the floor, you want to make sure that it's interesting for them. So you need to get down with them so that you encourage them to lift their head to look at you. So you can also carry a baby in that football carry, which is you hold them in your arm with your hand under their chest. And this is sometimes easier for dads to do because they're stronger. So basically we want to just make sure that you understand that these two conditions, torticollis and plagiocephaly, can be commonly seen in infants and newborns, and the best thing that you can do is to get some treatment for them as soon as possible. So if as a parent you have these concerns, please bring it up with your pediatrician. You can also call either of our offices in Allen or Mansfield, and we would be happy to have your baby and you come in for a free screening to determine if any further intervention is necessary. Take care of your babies.